the Iowa Department of Public Health and the CDC have gathered some important data about Iowa's youth. In 2018, 1 in 5 Iowa students seriously considered suicide. In 2019, nearly half of Iowa public high school students had used an electronic vaping product. 3 out of 4 public high school students did not get 8 or more hours of sleep on an average school night. How do we know? Because in past years, Iowa schools like yours participated in critical youth health behavior surveys. This fall, your school can contribute to this vital data gathering process by participating in the Iowa Youth Survey and, if selected, the jointly administered Youth Risk Behavior Survey. By participating, your school will give us a glimpse into COVID-19 impacts on Iowa schools and students. Your responses will give youth advocacy groups the data they need to support positive change in our state.
I use both the Iowa Youth Survey and the Iowa Youth Risk Behavior Survey to advocate for school mental health services coming out of the pandemic.
I will use the Iowa Youth Risk Behavior Survey data to strategize opportunities for state agency collaboration to improve youth outcomes in Iowa.
I use the YRBS data to help inform and update the health curricula for all of Iowa students.
I use the Iowa Youth Risk Behavior Survey data to look at mental health, to look at sexual health, substance use, and violence.
Even Iowa student leaders are eager to use the data to help set their priorities for student advocacy.
I use the Iowa Youth Risk Behavior Survey data to advocate for updates in the health curricula used in Iowa classrooms.
I will use the ACE's data on adverse childhood experiences from the YRBS to establish a trauma-informed school environment for our students.
I will use the Iowa Youth Risk Behavior Survey to advocate for gender equity.
And youth data specialists at the Iowa Department of Public Health anticipate the critical funding and program opportunities that this actionable data brings to our state.
The data that we use from these surveys is critically important. It allows us to bring federal funding, about $450,000, into the state.
The information collected is invaluable to school planners, including administrators, guidance counselors, and curriculum coordinators, as well as state and community allies.
I also look at the Iowa Youth Survey to look at youth connectedness. We do know that young people who feel connected to their schools and their homes, that is a protective factor for them.
Users of Iowa Youth Health Behavior data will now gain access to ACE's data through the Youth Risk Behavior Survey.
For the first time, the Iowa Youth Risk Behavior Survey will include 16 questions on adverse childhood experiences.
I also use this data to equip the health educators that are going into the classrooms so that they are aware of current trends. They are aware of the issues that are affecting our young people. They are aware of the disparities that exist, and then they can tailor their programs to better meet the needs of the young people they're serving.
Based on your feedback, we've simplified the school participation process for both surveys.
This year, we've taken several steps to reduce burden on schools and students, including joint administration surveys and a streamlined, easier to take Iowa Youth Survey.
I'm incredibly grateful to the schools and the young people that have completed these surveys in the past, and I just strongly encourage you to do so again in the fall.
Please participate in the Iowa YRBS this fall.
Thank you for your support. To learn more about the Iowa YRBS, visit us online. This project is part of a partnership between the CDC, the Iowa Department of Public Health, and Iowa State University.